And joining us on the line this morning about the private healthcare facilities charges, we have David Lam. He's the medical sector representative in the Legislative Council. He's a legislator. Good morning, Mr. Lam.
Good morning.
And also Dorothy Young. She's a researcher at our Hong Kong Foundation. Good morning, Ms. Young.
Good morning. Thank you for having me.
Right. So just to give us some context before we start, it's basically the Consumer Council said earlier that private hospitals lack transparency when it comes to pricing information. And this study was published in March. So basically that there's discrepancy in prices for the same kind of treatment in different private hospitals. And the Health Bureau is saying that they want more clarity, basically. So David Lam, what kind of clarity do we need, do you think, about pricing?
Now, from a patient's perspective, the best kind of information is to know how much I'm supposed to pay when I am discharged from the hospital. So an upfront knowledge would be very useful. A more useful kind of information or timing would be when I see a doctor for a condition such as a hernia, when I quite understand that I need surgery. So before I choose my doctor, one consideration, well, there are certainly other considerations, but one consideration might be the pricing. So if I can have a grasp of how much my final medical bill size will be if I see this particular doctor and another doctor, or one hospital versus another hospital, even before I step into the consultation, that kind of information will be very useful. So it's not like you compare only at the very end, but you tell the patient up front. I think that's something we should be driving at.
David, good morning. It's Mike Rouse. What exactly is the present situation and why is it causing disquiet?
Well, to start with, talking about a few decades ago, private hospitals are for the really well-off people. So there wouldn't be that much of a discussion about pricing. However, as time comes by, more and more of the general public uses private healthcare services. And then price becomes more and more important an issue, especially when we nowadays usually have medical insurance. And the reimbursement of medical insurance is not always transparent, as you might understand. So leaving the patients kind of hanging in the limbo. So he may not really know how much he has to pay out of his pocket, even though he knows how much the doctor in the hospital is going to charge him. And even that charge can change because of different medical conditions and complexities during surgery.
So there could be two levels of ignorance, in a sense. That is, the charge from the doctor and the amount of the reimbursement from the medical insurance.
Yes, exactly.
Yeah. So Dorothy Young, I mean, David Lam pointed just now that we also need transparency from the insurance industry as to how much patients can redeem. From your research, what have you found? Which is the most problematic part? The surgical treatment, trying to get money back from insurance. What in your view is the most problematic as far as pricing is concerned?
For what we have researched on, we have found that different insurance sector, different insurance company will have, of course, different rules behind their policy, and that's why sometimes for the general public it might not be so apparent for them how much they are going to be able to reimburse from the insurance companies. And when they purchase the insurance, most of the time they can only see the fee of services, the schedule of fees, which they might see, this for the doctor attendance fee, a certain amount might be covered, but for example, for general ward. But then how much exactly does it really cover at the end remains a question for the public, as they maybe when they submit some documents to the insurance company, they found out that some part of the medical fees might not be covered. So what we are suggesting in here is to continue to encourage the use of pre-approval process, which is also commonly used in the insurance sector. So the patient at first obtained the budget estimate from the hospital, and they also submit it to the insurance company. So in the very upfront, they will know how much the insurance is going to pay for that medical surgery or treatment.
Good morning, Dorothy. I'm trying to get a picture in my mind of the scale of what's going on. As David just said earlier, that really, at one time, it was where everyone went to a public hospital. It's only in sort of relatively recent years that more and more private hospitals have come out, and more people now feel that they can afford to go there. And then, of course, they want medical insurance. In terms of overall healthcare, what share is still the public sector?
Actually, for the public sector, we are still having having a very huge share of the services. For example, for inpatient services, 90% of the inpatient services are provided by the government. We can see that there is therefore a very huge burden on the government on providing public services. But at the same time, for example, when we are talking about manpower issue, when we're talking about the amount of doctor, actually 60% of the doctor are now in the private sector. So we can definitely see misallocation of resources or imbalance of resources in the healthcare system.
Well, that's a very useful background to where we're going. So those who are going private, do they all take out medical insurance, or do some people risk it and just pay as they go?
From the Consumer Council report, we can see that out of that 60% of the 45% of the complaints are price disputes, and 60% of them didn't really check the price in advance. And we can see a majority of them the majority of them have medical insurance. So might be medical insurance might be the reason that people are not so price sensitive. And at the same time, we believe that with VHIS, which is a good development, more people are nowadays choosing private services because everyone knows that the public system will have a longer waiting time. So some of them who have voluntary healthcare insurance or other private healthcare insurance might not want to wait that long, and they prefer to choose private healthcare services. And to that, they will choose private services in Hong Kong or private services in the GBA, which is also more common nowadays. And
right.
Sorry.
Yeah, David Lam, before you have to go in 5 minutes, often it's the case is when a person gets sick, they go to a particular private doctor, and that private doctor say, oh, you need surgery, and we go to hospital A, right? And then I find out that hospital B is actually cheaper. And then now that your doctor say, oh, I don't operate in hospital B. What do you suggest a patient can do? Switch doctors? It's a very stressful thing to do when the person's already in need of surgery, isn't it?
Well, that comes back to my very first point, is that we have information upfront available to the patient before he even steps into the office of the doctor. Now, if you force a doctor to go operate in a hospital where he is not used to, and he's not working in good partnership with the nurses there, he doesn't understand the culture there, he's not familiar with the equipment there, then the patient is really putting himself into jeopardy by requesting him to be operated in a hospital where the patient is not familiar with. So that's better avoided.
Okay,
of course, there are some doctors who work in different hospitals, and you can certainly talk to them.
Right. So pick your doctor carefully in the first place. They were saying. Okay. So as far as getting the hospitals to comply, what in the Legislative Council are you going to suggest to make sure that they're transparent?
Now, we always supported transparency, and the government proposed reform of the legislature in order to enforce a higher degree of transparency. Now, transparency is fine. Another matter is about fee certainty. We must understand that healthcare, and especially major surgical operations, are inherently complex and unpredictable. So when things happen, we know the percentage when a major complication may occur, but we cannot predict who falls into that percentage of a complication. And in case a complication happens, then the patient may require a prolonged hospital stay, more medication, another salvage surgery, or even days in ICU, more imaging, and that really amounts to a fortune. So the predictability in these situations can be quite low. And one must also understand that however good-hearted a doctor might be in terms of providing transparency for fees, he will not be able to predict how many, for instance, polyps a patient has in his colon before he proceeds to a colonoscopy. So it is not quite possible for the doctor to predict exactly whether he will need to use some instruments for removing the polyps and how many polyps has to be sent for histology. And lab charges, they don't charge according to the number of polyps, but they charge according to the number of bottles you send them. And we put polyps of the same segment of a colon into one bottle. And in case there is a suspiciously looking or malignant looking polyp, then we put it in another bottle. So again, before the colonoscopy, I cannot predict how many bottles will I finally send off. So there is a certain degree of unpredictability, and that's what we are talking about, fee certainty. It's fine for the doctor's fee. I can charge one fixed sum, irrespective of the hours I take for a particular surgery and the days a patient stays in a hospital. But then what about the hospital? If you spend 3 more hours in the operating room, you use the room, the nursing staff, the equipment, the medicine, and then the patient stay another day in ICU, the hospital has to charge the patient. So the unpredictability often lies in the hospital charges, which again, the hospital cannot decide for itself what will be used because it is the doctor who makes the order, and the doctor makes the order according to the condition of the patient. So we're kind of reactive to the patient's need.
And some of these things...
something we have to understand. It's not that, we are just charging like whatever we hope to receive. No, it's not like that.
Sorry, and some of these things might only become apparent during the operation.
Or even after. Or even after, a few days after major surgery, the patient has a sudden kick of fever, abdominal pain, and some mucky material comes out of the surgical drain, then you know something was wrong inside. You go for a CT scan, you start giving the patient fluid, you put him near by mouth, and then antibiotics, and then you may need another surgery. And after that surgery, he may need ICU care. So how do you predict that?
So things during and after can be unforeseen.
So exactly, that is what we are talking about. Insurance, that's the purpose of insurance, insuring against the unpredictable. And if you put all those responsibility onto the hospital, no way, you are going to bear it, package price, whatever happens, you're going to charge that amount. Is it correct? Is it not an insurer's responsibility to insure a patient against unpredictabilities?
Right.
So these are things we have to consider, not just to put the burden on the hospital and the doctors.
Yeah.
We are reactive. We're responsive sometimes to the condition of the patient.
Yeah. So you're going to push for transparency with the insurance sector?
Both sides.
Yeah.
Both sides.
Yeah.
Both sides. Now, if you talk about insurance, the standard plans are fine. But if you talk about the high-end plans, they say they reimburse everything, provided the charges are customary and reasonable. But what is customary and reasonable is up to their own interpretation. Mm-hmm. So I agree with Ms. Young here that we should go for a universal pre-approval of the charges of the reimbursement. I actually put this to the Hong Kong Federation of Insurers back in 2018 or 19 maybe. But somehow it wasn't really implemented. But if we have a central platform for pre-approval, then before surgery, the insurance companies will know how much they have to pay, and the patients will know how much he has to pay out of pocket. That is good for everyone.
Right.
I think that's just the right way to go.
All right. Well, thank you very much, David Lam, from the Legislative Council.